Good morning. I want to welcome everyone to the third meeting of the 2022 Interim Joint Committee of Education. I would also ask that each of you please silence your phones in order to avoid interruption. And with that, Mariah, would you please call the roll?
Senator Carroll, Senator Givens, Senator Harper Angel, Senator Higdon, Senator Kerr, Senator Meredith,
Present.
Senator Neal, Senator Southworth, Senator Stivers, Senator Thomas,
Can't really say anything because I was speaking.
Senator West,
Here.
Senator Wilson, Representative Baker,
Present.
Representative Banta, Representative Bojanowski,
Here.
Representative Decker,
Present.
Representative Donahue,
Yes, ma'am.
Representative Dossett, Representative Hart,
Here.
Representative Lewis,
Here.
Representative Massey, Representative McCool,
Here.
Representative McCoy, Representative Miller, Representative Gibbons-Prunty,
Here.
Representative Rayburn, Representative Riley, Representative Scott, Representative Timoney, Representative Tipton,
Here.
Representative Weber, Representative Wilner,
Here.
Co-Chair Wise,
Present.
Co-Chair Huff.
Present. I would also like to welcome Co-Chair Wise. Do you have any introductions or any words of wisdom for us this
All
morning?
good. No, thank you.
Okay, thank you. Also, I think Senator Thomas would like to have an introduction or a word.
Thank you, Chairperson Huff. And that's a great segue because I want to talk about Senator Wise for a minute. First of all, I want to welcome our Lieutenant Governor Coleman. It's good to see you, Lieutenant Governor Coleman. I've made it clear, I'm about this interim committee session spreading good news. I've been tired of hearing about all the bad things Kentucky does for the last 9 years. So this interim session, I'm talking about all the good things Kentucky does. And of course, a couple of weeks ago, we came back from the National Conference of State Legislators, NCSL. And at that meeting, Senator Wise, our co-chair, was a panelist on probably the most important committee we held there, which was, innovations of education in the 21st century. And Senator Wise did an excellent job representing Kentucky as a panelist on that distinguished group, which included our former Commissioner of Education as well. So I just want to compliment Senator Wise for the fine work he did as a panelist on that very innovative group.
Thank you, Senator Thomas. And I hope Dr. Heather Wise is watching today to hear those words that you said. Greatly appreciated. Thank you, Reggie.
Thank you. Our first order of business will be to approve the minutes for the meeting dated July 15th. Do I have a motion? Second. We have a motion and a second. All in favor? Aye. All opposed? The minutes are approved. We have a limited agenda, but a very important agenda today. We're going to begin with the Team Kentucky Student Mental Health Initiative with the Lieutenant Governor, Jacqueline Coleman, and the student advisors. And it's always nice to welcome students into our committee for them to share, since they are the group that this committee is charged to provide a world-class education. So we look forward to your presentation, and introduce yourself for the record and your guest, and please proceed.
Thank you so much, Representative Huff, and it is great to see you all. I'm going to start by introducing the students who are part of this group that could not make it today, and then I'm going to let the ones who could introduce themselves. But for the record, I'm Lieutenant Governor Jacqueline Coleman. The students who could not join us today but have played an integral role in this work that we've done are Delaney Daughtery, Dylan Tipton, Roheen Dutt, Rox Lockard, Sam Smith, Soleila Gonzalez, and Ollie Fagenbush. And so then we'll start down here with you, Soliana, and we can just do introductions down the row.
Hi, my name is Soliana Mason. I'm a recent graduate from Eastern High School in Louisville, Kentucky in Jefferson County, and I'm attending the University of Louisville this fall.
Hi, my name is Julia Eady. I'm a recent graduate of Round County Senior High School, and I'm currently attending Eastern Kentucky University.
Hi, my name is Bentley White. I am a junior at Kentucky School for the Deaf in Denver, Kentucky.
Hi, my name is Alexandra Perry. I am a senior at the Ignite Institute.
Hi, my name is Splendina Pavlori, and I'm a senior at DuPont Manual High School in Louisville, Kentucky.
I'll just try to speak loud. Hi, everyone. I am a rising senior at Marion County High School, and my name is Charlie Brown.
I'm Logan Justice. I'm from Fayette County. Just graduated from Dunbar High School, and I'm going to UK right now.
All right. So before we get started, I'm going to turn it over to Soliana to do a little bit of, I think, some participation from you all. So.
Yes. So before our pre-activity, I would just like to note something. We did place these little, what's it called?
If you would, I'm sorry to interrupt you, but if you would please just go to the mic so we'll be able to pick up
Thank you.
everything you say. Thank
Amazing.
you.
Thank you. So we place these ribbons on each of y'all's desks where it's a symbol for mental health awareness, and you guys are welcome to wear it if you would like and to have it. We are all wearing it today. So now let's get into the kind of pre-work, some little classwork for today. We have a QR code on all of the screens up here, and this QR code, if you take a picture of it, if you hold your phones up to it, it should have a link to it, and that link is a direct link to a survey. It's just going to resemble a mental health check-in, and we want to emphasize the importance of that. It's really important to check in with your students, whether you're in a classroom, just to gauge what the classroom feeling is like, and to understand the needs of your students in that current time. And so what this survey will do is that it will ask you a series of 5 questions, I believe, and it is completely anonymous. There's no way we can link it back to you. Where it just asks you about questions about your mood, questions relating to how you are today, and I will give you all a minute to answer that. If anyone has questions, let me know. If it's not working, we did place a link which you could type into your browser. But when everybody seems to be finished, I will go over the survey results, which is completely anonymous again.
Members, you have a copy of that in your handout that might be easier to take the picture of.
Okay, so right now we have about 11 responses. Please keep on bringing those in, but I think this is a good gauge of what the room is feeling. So amazingly, for our first scale, how excited you all are for this presentation. The majority of you guys have said a 5, and you guys could see the survey results right here, which we're very excited for. And then it asks questions about how your morning was and the color that best reflects how you feel. So little fun things depending on, as well as your mood and certain things. And we try to keep it fun. We try to, when it comes to check-ins, we want to make it as different as possible, as engaging as possible for students. So this doesn't feel like a task, but rather a teacher or somebody genuinely caring about the students' well-being. And you know, we have some fun things like emojis here, and so you guys are able to have a little bit of fun with that, but it's just a nice way to start off a classroom, a discussion, a lecture, whatever it might be, just to know that students' well-being is at the forefront prior to anything relating to the lesson, and that they're supported in every way possible. And this is completely anonymous, so it is inclusive of students who would rather not speak up and go forward themselves. So it's a really nice tool, and we're so glad that you guys participated in it. Thank you.
Thank you, Soliana. So that was a quick kind of a check-in. A lot of ways that our teachers check in with our students when they walk in the room to just take a temperature of the room and to see where their students are is something as simple but as meaningful as this. And so we wanted you all to experience that as well. So my job today is to tee this up for these students. And so that's what I'm going to do. I'm going to give you a little bit of a background of mental health in Kentucky as it relates to students. We'll talk a lot about pre-pandemic, during pandemic, kind of post-pandemic. And so let me make this point before I start. We all know that the pandemic came with its own set of challenges and certainly created new issues that none of us had to deal with before. But what it also did was it exacerbated old ones. And this is one of the existing challenges that we faced that lie just below the surface, that once the pandemic hit, we could no longer kind of push to the side or push down or have 30,000-foot conversations about it. It was real. It was in our homes. It was in our families. It was in our classrooms. And so that's why this group is here before you today. And so just to kind of set the scene, because they're going to give you the important part that we want you to help us with. So before the pandemic, so this is back in 2018, which seems like maybe a million years ago now, the CDC reported that there were about 1 in 5 children that had a mental disorder. But here's the important part. Only 20% of those students actually receive care from a specialized mental health provider. There was a Kentucky Youth Risk Behavior Survey. About 30% of high school students reported feeling sad or hopeless to the point of stopping activities. 57% of students in Kentucky ages 12 to 17, according to this survey, with a major depressive episode did not receive mental health care. And so again, we're seeing that there are clearly barriers to care here. 15% of high school students reported seriously considering suicide. And we know that in itself is becoming a very daunting issue for young people, certainly in Kentucky and across the country. So our students wanted help addressing or improving their wellness, but they didn't know how or where to get it. This is, again, students who are self-reporting. And they also acknowledged that stigma was a major barrier coming from many places. Social media, their friends, their family, community, maybe their heritage or even their religion kept so many students from I think going forward to find how they could get help. So now we're during the pandemic in 2019, 2020. This is going to come as no surprise to anyone in this room, but nationally, there was a 21% increase in children diagnosed with behavioral or conduct problems. And so the Kentucky Student Voice Team, which is another phenomenal group of young people who do great work around the Commonwealth, did their own study, and they found that students were feeling unmotivated, stressed, and anxious. They felt more grateful, which I think anecdotally I would kind of attach to the fact that maybe we took a lot of things for granted before the pandemic, that we were reminded during it how much we needed that interaction and activity and things like that. 46% of poor students socioeconomically reported feeling depressed, compared to about 27% of middle class students. So there we see immediately a gap in care as well. Online learning was an extremely divisive subject, as you can imagine, on this study that the student voice team did. 47% of students felt a negative change, 11% felt a positive one, 38% were about neutral. And in tandem with this emotional distress that students felt, there was an increased desire for help. and mental health services that they needed. So now we are in the part where we came to the conclusion that these student mental health action summits were necessary. All of this data that I just read off to you was, like I said, brewing in our homes, in our communities, and in our classrooms, and our churches. And so, as many of you know, I serve on the State Board of Education. I've spent my life in the classroom as a teacher and an assistant principal and a basketball coach. So I knew, I'm also married to a teacher, so I got to hear about it every day. But I knew that as students returned to in-person learning, there would be challenges academically, certainly. But also I suspected it would be pretty hard for them socially and emotionally. And so what I wanted was to hear directly from students. So many times we hear about mental health, student mental health, as adults talk to other adults, which I think is really important. I know there was a trio that were here, I think last month, of administrators who spoke about it. 3 people I deeply admire and I know had great perspective on that. But you're looking at the experts up here. These are the people that we need to hear from as we work to address this issue that has arisen that we have to take on. It was also a really opportune time to talk about it because we started to see a lot of professional and Olympic athletes like Simone Biles and Michael Phelps and folks like that start to be very public about the challenges that they face. And certainly when you see someone who is so famous and successful, to hear them say, you know what, I have a challenge the same way that you do. It certainly makes students feel more comfortable. And it helps to take on that stigma that we just noted is a barrier to students reaching out for help. And so to plan these events, I borrowed the Kentucky Department of Education's Student Advisory Council, which are the students you see here today. And we started to plan a work group. Every decision was made by them, every one. They are our most critical partners, and they are the ones who did the work of designing the mental health action summits, of implementing them and facilitating the conversations that they're going to tell you about today. They dove into the data that we gathered and captured from those meetings, and they aligned all of that with national studies going on at the same time to bring to you today proposals for policy changes that they would like to see, according to their peers in Kentucky, made to help out students in our schools in Kentucky. So in addition to the Department of Education, we have every educational cooperative in the state was a partner. They were on the ground. They essentially co-hosted our events for us. We partnered with the Department for Behavioral Health at CHFS. We were committed to having a mental health clinician present at every single summit so that should an issue arise, we had a professional there to provide support as needed. The Division of Family Resource Youth Service Centers at CHFS also helped us. They are our angels on earth in the schools. I wish people outside of a school building knew what our Friskies did. But they were the one adult present in the room with the student groups as they broke out. They were assigned the role of scribe in many instances to capture that really high level response and data that we needed to pull back to be able to make these policy recommendations to you. And so we worked with our student advisors and partners to design these events. And when we were there to have them, they were the ones that promoted them on the ground. So all of that said, that's where we've been, and that's what brought us here. And so I'm going to turn it over to Julia to start to tell you a little bit more about the action summits.
Hi. So as you can see, we held 10 events all across the state in partnership with the regional education cooperatives. There were 9 regions, and 7 were in person and 3 were virtual. Attendance was largely regional, but we did host one virtual statewide event that we opened participation for to any student across the Commonwealth. We often mentioned the statewide event when we were in person at other events so that they could tell their classmates about it. Due to COVID surges, in some cases we pivoted the events to be virtual for everyone's safety. when necessary, but we left that up to the regions as much as possible to decide whether they wanted virtual or in person. So of our 10 events, 7 were in person and 3 were held virtually over Zoom. I facilitated 1 in person at the Kentucky Education Development Corporation and 1 virtual at the Kentucky Valley Educational Corporation. We had an online registration process for students to sign up to attend. It wasn't required, but it was definitely recommended. Through that process, we had approximately 375 students registered to participate. At the events, we did not have a sign-in or check-in process, but based on headcounts, we estimate that over 300 students attended the 10 events. Throughout the events, we hosted around 25 breakout sessions, which we will discuss in further detail momentarily. So at every event, whether in person or virtual, after a welcome from the Lieutenant Governor, one of our fellow student advisors would present basic student mental health data and frame up for the students why they were there. We would then send students into a breakout session, usually 5 to 15 students, depending on the region. But before we sent them off to the breakout sessions, we would introduce our local mental health clinician who is in attendance, just so that they knew that they had access to a mental health clinician in case they wanted to talk with them throughout the session. Although we never had a student do this, it was an important gesture to normalize talking to a professional about mental health. Once students were in their breakout session, each group was facilitated by a student, usually someone from the counselor, and we even had some local students from the region. Each breakout session lasted about an hour, and we had one adult, as the Lieutenant Governor said, the Frisky, who played the role of the scribe, the timekeeper, and the monitor. So after introductions and a few icebreakers, the student facilitator led the students through a series of questions about student mental health. So now we're going to talk about the questions we asked during our breakout sessions and what the students told us in response. So I'm going to pass it over to Bentley.
So we asked a series of 6 questions, 4 of which were just general questions that we had asked, and the last 2 were questions that we may not have always gotten to within our breakout sessions, but we tried. So the first question was, how does your school or home life in general affect your mental health? And responses we heard were that circumstances vary on a case-by-case basis for students. The school itself can affect mental health either positively or negatively, or it can just cause a neutral shift in mental health. It just, once again, depends on a case-by-case basis. And a majority of students found that a transition back to in-person learning from being virtual during COVID was quite challenging. Our second question was, what mental health challenges have you or your friends faced in the past year? And this is as of last November. So responses included people feeling anxiety or overwhelmed going back to school. People felt depression, large cases of major depressive episodes, and there was low motivation, especially during COVID, and people were lacking a sense of accountability and what to do. The third question was, what mental health resources do you wish you had access to at school? And responses we heard were people wanted access to resources, but they didn't only want to know how, but they didn't want just access to resources. They also wanted the ability to know how and where to get these resources. Because in some cases there are resources, but they just don't know that it's there. They wanted space at schools or breaks during the day so that they can get away from the stress that occurs during everyday school life. They wanted the ability to take mental health days, just a day to call in and ask to not go to school because they weren't up to it. They wanted more trainings for teachers, faculty, and students, teachers, staff, and students. And they wanted these trainings to be more up to date not just a VHS tape that gets played before September 14th. And they wanted access to a mental health clinician at school and someone that students can talk to and who they have built a rapport with and that they can trust to talk to their problems if they arise. And the fourth question was, what recommendations on mental health do you have for our policymakers? So you guys. Some of these responses were that students were maxed out in regards to what they did at school. They were asking for non-academic breaks throughout the school day. They wanted more flexibility in regards to their assignments and homework after school. And they wanted spaces in school for students to decompress if necessary. They wanted access to mental health days, which we saw this a lot. They wanted mental health to be an excused absence, but not only for students, but also for faculty and staff within schools. They wanted help in raising awareness and reducing stigma connected to mental health challenges. We want mental health embedded into other things we learn and make it interdisciplinary. So it's not just one thing that you discuss, it's connected to everything. Greater access to clinicians at school, but someone students feel comfortable talking to and who they trust. Updated suicide prevention training for both faculty, staff, and students. And having a mandatory class or workshop on mental health, like a financial literacy class, but taught by a certified licensed professional. And the last two questions, they weren't always asked due to time constraints. The responses were often echoes of the other responses that we heard. Finally, after the events, we would send out a follow-up survey to students who registered, and it was apparent from the responses that one of their major takeaways was that they were not alone in their mental health challenges, and that a lot of other students struggle with mental health too. These events help them normalize being able to talk about it with their peers. Now, what we heard in summary, the things that you see on the slide are a representation of what we heard from the students as we talked to them at the events and after. And the surveys that we did after the events were a chance for the students to share anonymously, so that way if they didn't want to speak up during the events, they still were heard. In our follow-up survey, sorry. Oh, sorry, okay. So that's about it, sorry.
Okay, so while we were listening to our students, while this work was going on, and your students here were creating these mental health summits, they were implementing them, they were facilitating these really important conversations, and then digging into the data to find these recommendations for you. Here's what was going on around us, and I have to say I'm very proud of Kentucky because in many senses of this work, we are ahead of what we see going on in other states, and we are flowing right with a national momentum here. So in October of 2021, we have the White House's fact sheet on improving access and care for youth mental health and substance use conditions. The U.S. Department of Education issued a report on supporting child and student social, emotional, behavioral, and mental health needs. And the American Academy of Pediatrics declared a national emergency in child and adolescent mental health. The following year, in December of 2021, the U.S. Surgeon General issued an advisory on protecting youth mental health. And so, as you can see, we are operating right along with the trends that are emerging nationally. And so we want to make sure that we continue to stay ahead of that curve. And so I'm going to turn it over now to Alex, and you're going to hear about the student recommendations that they were able to pull out of the data. You all have a one-pager that was given to you, and there's a legend on there that shows you how each of these relate back to what these national groups that I just mentioned have included in their advisories and their reports.
So before we share with you some of the recommendations that have been developed, We wanted to share with you the process that we did after the events and how we got there. So immediately following the conclusion of the events, we collected all of the data that was captured and put it and transcribed it into a document that we then shared with our student advisors. Then the advisors and the lieutenant governor reviewed the data together and discussed prominent trends and common issues. Then they began drafting recommendations. Alongside staff, they found specific language to use and did their own research on rationale and best practices occurring in Kentucky and the country. Following this, the students presented the recommendations to the lieutenant governor and shared their early findings with event partners. After finalizing the recommendations, they began sharing the information with stakeholders. But now let's get to the recommendations. Because we only have a limited amount of time to show the work that we produced, we are showing an abbreviated version of our recommendations. In all, we had 10 recommendations, but we will only show 6 today. As seen on the screen are our 6 recommendations for today. Our first recommendation is to include and elevate student voice. Foundationally, we think it is critical that student voice is included at all levels of decision making. Our second recommendation is to provide comprehensive suicide prevention. Our third is to allow excused mental health absences. Our fourth is to expand access to mental health services and treatment. Fifth, to increase mental health awareness and education. And sixth, to increase and improve mental health professional development. However, we do have 4 other recommendations not listed. These recommendations are no less important than the ones shown today. These recommendations include offering mental health check-ins, offering mental health breaks, increasing awareness of and support for eating disorders, and prioritizing and improving school culture and climate.
Yeah, thank you so much. And with that, I think we can go ahead and get into recommendations, which I know you guys have been waiting for. So our first recommendation is including and elevating student voice. And let me be clear by what this means. It doesn't mean just having students at the table. It means authentically including them in the conversations that we're having and really valuing their insights and thoughts and opinions. We have more superficial forms of student voice, which include students just being consulted in a predetermined adult-made agenda. But then we also have very meaningful forms of student voice where students are really uplifted as partners and leaders in their education decision-making processes, and that's obviously what we want to be leaning more towards. I think I can speak personally that my youth is always something I've had to apologize for when it comes to me being legitimate and being valued in education spaces, but I think now I can look back and say it's definitely something that makes me more qualified, because a lot of times students really aren't seen as experts in their own educations, even though they are at school 5 days a week, 7 hours a day. And then there's also a multitude of ways we really can do this raising of student voice. And there's a ton of resources. I know Kentucky Student Voice Team has a ton of handouts, so it makes it easier on educators and administrators to do that. Second is providing comprehensive suicide prevention. So first, we recommend that, these suicide prevention materials and resources are available every place you look in a school building. And you might think, they're already in a couple of places, that's fine. But like Lieutenant Governor said, there's a huge accessibility barrier. A lot of students need help and they're not getting it. And maybe it will make that difference for that one student to see this pamphlet or to see the suicide hotline and know, okay, this is how I can get help with what I'm struggling with. And second, we recommend offering evidence-informed suicide prevention curriculum at least twice annually. We recommend to partner with the Department of Behavioral Health. I think I speak for a lot of students when I say our suicide prevention lessons or materials often seem very static and like they're just done because they're required. And that can be very dehumanizing to feel like, this is such an important topic and we only have 30 minutes, like one day a year, and that's all that's given to it. It feels very meaningless sometimes. And so making sure that these are updated, they're catered to the right audience, and that we're actually having authentic conversations about it is huge.
All right. Next, we have mental health absences. First, I'd like to thank the representatives who passed House Bill 44, and a big thank you to Wilner and McCool for taking the initiative for this bill. But we want to take it just a bigger step forward, to not make it recommended but required in schools, and to have 6 excused mental health absences per school year. Next, there is expanding access to mental health services and treatment. As you can see on the screen, this is fund a licensed mental health professional every day at every K-12 school, and offer peer mentoring and peer support for students who are not comfortable with talking with an adult. I'm very passionate about this recommendation because I know it's achievable. At Marion County High School, our Frisky sets aside $3,500 of the Frisky grant money to help students who can't afford copays or private pay for mental health services. Thank you.
All right, and our last 2 recommendations really, I think, focus on kind of educating yourself, the students, and the teachers both around mental health and what all it is about. So our 5th recommendation is to increase mental health awareness and education. So in this one is really focused just on the students. So we want to foster a stigma-free school environment, and by doing this, or in how we can get there, is by educating our students on mental health. Like we've talked about, we would like to update that suicide prevention materials, but also take it a step further. There's a lot of other mental health areas other than just suicide. Like we talked about eating disorders, depression, anxiety, all of those type of things that students do face, just as they face thoughts about suicide, are important and should be covered in that mental health curriculum. We would also really like that to also include not only about that, but how that they can cope with that, and so that they can practice executive coping skills. And all of this, we would like it to be evidence-based and discussion-based, so that students aren't just being talked out about it, but that they can be part of that process to talk about. What we found out in those little discussion rooms is that when students can get together and talk about what they're feeling and how they are going through that, they learn a lot more. And one of our biggest takeaways was that, if anything else, we were able to start the conversation around mental health. And if we could do that in every school, that would be an amazing accomplishment to break through to hopefully a better, more stigma-free school around mental health. And then our next recommendation is increase and improve professional development. Now, I know that we've talked a lot about this, and the Lieutenant Governor has talked about the bloodborne pathogens professional development that has to be taken ever so often, and yet she's never really had to use it. And I think it's important to really kind of refocus the professional development. So when we say increase and improve the professional development around mental health, it's not only saying, well, let's add a course to it. Let's really look at all the professional development teachers and educators have to do, and refocus that, reframe that around things that will really help the students, such as mental health, professional development, and then also making sure that it's regularly. I think both of these recommendations just really show that mental health is such a vast and complex issue that even though we've been working on it a year, we've just really kind of hit the surface of it. And for people that haven't even really, they know they're struggling, they don't know necessarily how or why, having these kind of opportunities to learn more will be able to help them, and in return for educators to help their students. And again, that all kind of just goes to fostering that stigma-free environment in schools. So that's our 6 recommendations.
All right, and let me just clarify, I am not opposed to the bloodborne pathogen training. I just made a point to the students that I did it every single year, and thank goodness I never had to use it. And yet every single year I had classrooms full of students who were homeless or hungry or suffering silently from mental health, and I never had a professional development training on that. And so there's definitely room for improvement there. So as our students took the data and were digging through it and working on this presentation to give to you today, the momentum continued. And let me reiterate this as we talk about a bigger picture. We do not have all the answers. We have no playbook. There's no right or wrong answer. Well, I'll say this, there is a wrong answer, and that's to do nothing. But we don't have all of the answers. And so as we move forward, we're looking for partners in moving this policy forward, and that's why we're here today. So in February of 2022, what we saw was the Centers for Disease Control and Prevention declared the children's mental health an ongoing public health concern. It's not going away. It's something we're going to have to continue to address moving forward. In March, the president in the State of the Union address mentioned the White House fact sheet, which if it makes it into the State of the Union address, you know that it's a national issue. The U.S. Department of Health and Human Services announced a strategy to address mental health, and the HHS and the U.S. Department of Education announced a joint effort to ensure children have access to school-based health services. So we see this again at the national level, really consuming a lot of the airwaves and a lot of the resources in terms of studying what's going on. So in May, you see a picture there of our students in the rotunda, and they presented this to everyone. HHS, their leaders urged our states to maximize the effort to support children's mental health, which is what we're here to discuss today. But we also had the Student Mental Health Awareness Day at the Kentucky State Capitol. We did a ceremonial signing of House Bill 44, and Representatives McCool and Wilner were there with us. We raised the mental health awareness flag over the state capitol, thanks to Representative Tina Bojanowski and her work on that. My pin today is actually the mental health awareness flag. And just recently, so recently that we're still looking at it and analyzing it, the federal government just announced actions to strengthen school-based mental health services and to address the youth mental health crisis. And they are awarding the first of nearly $300 million secured through the bipartisan omnibus agreement to expand access to mental health services in schools. And they're encouraging states to invest more in school-based mental health services. So we are happy to be here with you today to show you 6 ways that we know that you can do that based on what our students are saying across the Commonwealth. We're still analyzing this bill, but certainly this is going to create some resources for us to be able to see these recommendations and others through. With that said, I want to say a thank you again to Representatives Wilner and McCool for House Bill 44, and then Senator Wise for Senate Bill 102 during the session. We appreciate that. And now I want to know if you have any questions for the students or myself regarding student mental health and how we can move forward together.
Thank you. We do have some questions, but I want to thank you, Lieutenant Governor, and each of you and those not present with us as well for having these conversations across our regions and raising awareness and trying to remove the stigma of mental health. Not only have our students endured a pandemic, but geographically they have endured disasters on both ends of the states, which has created another huge, heavy burden of mentally for our students. So I think these conversations are vital, and I appreciate your initiative and work there. We do have a list of questions, and this is the list that we're going to go by. We're limited on time. We do have another huge presentation before us, so if you have asked to ask a question, you will be asking, but we're not going to take any more requests for questions. We have Representative Bojanowski first, please.
Yes. So first of all, a shout out for Soliana. All of my children graduated from Eastern High School, so go Eagles. And then one key federal initiative that I think will have repercussions and support for our youth too is the new 988 mental health number. So it's like 911, but 988 for mental health concerns. And I'm very grateful to my colleagues that we put significant funds in to support that initiative. I think my point I want to reiterate is the importance of social emotional learning for our children throughout schooling. And this is before maybe they have a clinical mental health disorder, but it's teaching them how to regulate their emotions and how to potentially identify if there's something going on. So I'll keep it brief, but I do want to reiterate the importance of that social emotional learning in our school systems. Thank you.
Representative Gibbons-Prunty.
Thank you, Madam Chair, and thank you all so much. I was a director of youth ministry for almost 20 years, and I believe in young people and their voices, so I applaud the whole process and everything that you all have recommended, the authentic conversations, real conversations. The questions that I have, I wrote down first how many days would they have, and then I see in your recommendations you would recommend 6 excused absences. How did you come up with 6? And then the second question would be, how do you prevent abuse of that? How do you authenticate that that people aren't taking advantage of that? So thank you.
Anybody want to answer that? Okay. Anybody? Okay, I'll go on. So I have to say one of the most profound statements that one of our students made, they made it when I asked them that question. So when they came up with a recommendation for 6 days, and I went back into assistant principal mode and was like, well, how do we know that that won't be, abused? And so one of the things I suggested was, what if we required a note from a mental health provider in the same way that we do physical health? And Julia said, diagnosis is privilege. And that blew me away, because that's not something I ever had to worry about as a student. And so that is why, if you are able to, as they recommended, put mental health providers in school systems, then you can completely cut down on all of the either lack of communication or lack of intertwining of professionals. And that really helps to close the loop in many ways. One, for providing access to care that so many students are either afraid to ask for, don't know how to ask for, don't know where to go, but also to make sure that there is someone in that school building that can come to me as an assistant principal that deals with discipline and say, hey, we really need to sit down and talk about, what's going on here, because there's more to the story than what you're seeing. That can't be overstated how important that is. So I had the same question you did. Yeah,
Thank you.
go ahead.
Thank you.
Also, I'll introduce myself for the record before I speak. My name is Heather Deering. I am the Deputy Chief of Staff for the Lieutenant Governor. I've been privileged to work beside these young people. I also would say that there are 10 to 12 other states who have passed similar legislation that have gone further than HB 44 that we could learn from on policies and regulations that they've implemented around it for the prevention of abuse. We did see in one state, too, that 2 successive mental health absences would trigger some sort of intervention or call in from a school for follow-up to make sure something a crisis wasn't happening. So that's what I would say.
Thank you, Madam Chair.
Senator Wise.
Thank you, Madam Chair. Brief comments and a question. Lieutenant Governor and Heather, thank you all for being here this morning. And for your students, hats off, congratulations, and thanks for presenting. I know it's not easy being a teenager and to come in front of a group of adults in a committee like this. So thank you all for your presentation. In terms of recommendations and a lot of things that were provided here, we have done a very good job, Lieutenant Governor, you spoke upon this, of even going back even before the timeline that was mentioned there, of Senate Bill 1, School Safety and Resiliency Act, of putting some things in there as it relates to suicide prevention. And you're exactly correct. We don't need a 30-minute DVD. We need people like Talora Slosher, who's going out into school districts and talking about her daughter. I'm hoping that Jim Flynn and Bob Rowland, some of those with their associations, are listening today to encourage their superintendents and their principals and their school administrators of having good programs that are impactful and not just a DVD. Other things that we've done here in terms of that Sources of Strength program. Show of hands, how many of you young people, your high school had a Sources of Strength program? 1, 2, right? Those are some things that are out there. I wasn't knowledgeable about it until we did the legislation back in 2019, but some things that are there and that we're offering that's with our Cabinet for Health and Family Services. We need to elevate that. We need to get that on a bigger platform that we know of some things that could be offered. Also look at the Bounce program. Dr. Joe Bargione, who is working with school districts right now for that professional development for for staff and professional development. So there's things there. I think it also is elevating and highlighting those type of things so school districts know some of the resources that we have to offer. My question is, of looking at the data that you all were able to collect, was there any comparison of this data to pre-pandemic data? We did a lot of that in 2019 the Pritchard Committee, the Student Voice Team, just wanting to see in terms of the stress levels of mental health and anxiety, what was it in a pre-pandemic compared to where this data was collected now? Was there any collection of that?
So we and I'll let anyone else who wants to jump in, okay? We did look at studies that were done before and during and now. One of the statistics that stuck out that I mentioned earlier was that there was a 21% increase in behavior issues. We did not do a replica study of something that was done before the pandemic. We really did our own in the moment of where we were. But that data certainly shows with a 21% increase in behavioral issues that there's obviously an increase across the board. And I will say that one of the things the students told me that was funny but not funny is that their suicide preventions were not even DVDs. In some cases, they were VHSs. Yep. So in some cases, the DVD is updated. So being able to make sure that we're advancing the knowledge and information and education on that is critical. And with you pointing out all of the different resources that are out there, that's kind of the same process we went through as finding out what the Department of Education has, or finding out what programs are out there, what federal programs provide financial resources to states to be able to go further with implementation. And so we're really trying to close that loophole of everyone operating in a silo, right? And being able to bring every group to the table. They have presented to numerous agencies across state government, to administrators as well as educators, and now the legislature. And so we're really trying to kind of be that glue that brings folks together, because our students are leading this effort.
Perfect.
Does anybody else want to jump in?
Go ahead, Spanda.
Can actually speak on this a little because I actually currently get to lead the Coping with COVID study with the Kentucky Student Voice Team. And so the data you guys saw earlier was really in the height of right when school closed, May of 2020. That's when we disseminated that survey, and we had 9,000 upwards responses. And so we've just done another round of interviews with 20 students. These have been very intimate conversations about what it looks like for them and education for them. And what we see is a lot of the issues that were there May of 2020 at the height of the pandemic are still very, very much present. Students still talk about the struggles with motivation. They talk about a lack of routine, and how even being in person hasn't necessarily changed, the kind of dynamic and things that occurred when they were in a more remote setting. We have a lot of students talking about feeling disconnected and isolated from their peers, even if they are in person now. And I think one of the things that really stood out to me about our work was how much students talked about how there was one teacher who made the difference for them. One teacher who just gave them a couple minutes for socializing and put that in the agenda, because oftentimes we prioritize content in academic settings, but we really don't give enough space for students to just talk and be humans. And they talked about how there was this one teacher in their life who would talk about how they were struggling too, or how it was a weird situation, and it really, really does make the difference for students. So I think, like Lieutenant Governor said, a lot of issues were exacerbated, but just because students are in person now doesn't mean we can say they're not existing anymore.
And I'll just add, so we actually would be glad to make the data available to you if you're interested. We transcribed every response that every student gave us, and we regionalized the data. We made that data back available to the educational cooperatives so that as they were expanding their SEL programs and ESSER funding programs, they could tailor to what their students in that region said. But we are not data statisticians, and so it's a qualitative review of that data. We have explored looking at that data with KY Stats to maybe do some comparison. Be happy to make that data available to you. And we have, the last point is, this is the finale of a roadshow that these students have gone on. We have presented to all of the K groups. We have presented to about 3 or 4 of the KDE advisory groups and several other audiences. I think we did 3 or 4 conferences this summer. So you all are actually getting the final program of this roadshow. So we have been trying to tell anybody who will listen the recommendations that these students have made.
Thank you all so much. And once again, I've said it before, members up here have said it, funding, we're going into a legislative session.
Yes.
What we've done in the past with mental health services and everything involved with Senate Bill 1, let's fund it. Thank you all so much.
Thank you, Senator.
I appreciate these conversations about suicide prevention. In 2018, I passed 1 hour requirement for professional PD for teachers. I started out with 3, but I ended up with 1. But I think it's important that our PD be purposeful, and that was my objective. And I'm glad that we're continuing this conversation, and maybe we will get up there to where teachers feel comfortable in addressing the suicide with the students and bringing it forth to other professionals. We have a few more questions. Senator Thomas.
Thank you, Madam Chair. Madam Chair, I have one comment and then one question.
Please be brief, but go ahead.
First of all, my comment. You've heard me talk about Kentucky leading the way. And in my introductory comments, I talked about the National Conference of State Legislators. Okay. Well, you should know, Lieutenant Governor, that at the Southern Conference of State Legislators, which took place back in July in Oklahoma City, and I mentioned this at our last Education Committee meeting, Kentucky was cited as being the first Southern state to offer mental health awareness days. I want you students to know that. No other Southern state has done that other than Kentucky. You mentioned 12 have done it total, but Kentucky's the first Southern state to do that. So again, that's Kentucky leading the way in terms of recognizing the important work you're doing in talking about student mental health initiatives. Okay, that's my comment. Okay, my question to all of you. Since I've come to the Senate, I've been a staunch advocate of elevating and increasing student voice, what you have right here, with your recommendations. I think include and elevate student voice. And just last year, back in 2021, we passed a bill at the General Assembly to require that students sit on the state education board. First time it's ever been done. Okay. I want to hear from you. My question is to the students. One, I think the next step has to be, and we need to do it in 2023, is to give that student a vote on the state school board. Right now, that student has no vote. Okay, it's hard to say you have a voice when you don't have a vote. Okay, so I want to know what your opinion is on that. I've also been an advocate of putting students on local school boards. Okay, that hasn't been successful so far, but that doesn't mean I'm going to quit on that. Okay, so I want to know what your opinions are on having a student being placed on local school boards. So I want to hear from the students on those 2 initiatives.
Senator Thomas, thank you so much for your support of students. And I think there's no better person to answer this question than the very student who was the first student to ever serve on the state school board, and that is Soliana.
Thank you, Senator Thomas. I've never thanked you for your advocacy during that time, as well as many other of you. It was a very unpredictable time for the seat and for teacher seats as well, especially also to my Representative Nemus as well, who was able to speak for me when I couldn't. It is a very important subject, especially after our seats were threatened. It was after that, it was a caution time. It was a whole new thing where you were reimagining what does student voice mean in Kentucky, and what does student decision making mean in the state of Kentucky. I am glad to say that the Board of Education listens to teacher and student voice. It is not the same as having a vote. I understand that, but I'm grateful that even though in my non-voting capacity, that I do have a board that will value the student and teacher voice. Going off of that time in 2021, especially when it was threatened to be canceled, I do think it was necessary that the student be non-voting, just so that we could transition to a reality that voting students can happen, and that that legislators, that policymakers are able to appreciate that voting capacity. I would reckon that it would be very hard if the student were voting straight off the bat. So I do think a transition period was needed, and I do think that we should transition to a voting capacity very soon. The next student who is serving currently is non-voting, and the teacher as well. And to your point on local boards of education, that was the premise of establishing the seat on the Kentucky Board of Education. We wanted local boards to follow suit, and we also wanted local SBDMs or wherever decisions are being made for students to be on it and to make note that this is something that's happening at the state level, and this is also something that is very much can happen at the local level as well. And so we always, in every situation that we had, whether that be through subcommittees or advisories, student voice is essential, and we've been working on that through a cross-organizational lens with CPE, with the department and the board, and I hope that local boards will make a motion. We did also pass something in the board when I was there where it would be easier to establish a student seat on local boards of education, and that's one of the most proud things that I've witnessed as a student on the board. So our team stands for it 100%. Voting capacity needs to happen soon, and we hope that this is a widespread message that we can spread through Kentucky.
Yeah. So as you can see, Soliana's she's got big shoes to, or somebody has big shoes to fill for her. But that's the point I was going to make is every single school building has a site-based decision-making council. Every single school district has their own local board of education. And so there are lots of ways where we could get many students across the state involved. But as you said, I would love to see the student become a voting member of the state board of education.
Senator Higdon.
Thank you, Madam Chair, for allowing me to introduce my student from Marion County. But Heather, Lieutenant Governor, students, thank you all for being here this morning. I did want to recognize Miss Browning and thank her for her work in this area, and to wish her best wishes this weekend as she goes by a different title as participant number 21 in Marion County's Distinguished Young Woman Program. So good luck to you and best wishes. And thank you for being here today.
Members, I want to caution you on the time. We could talk to these young people all day long. So we have a few more questions. I asked you to be as brief as possible, and you can reach out to these individuals anytime later on to get further information. So I appreciate that and your respect in watching the time. Representative Tipton.
Thank you, Madam Chair, Lieutenant Governor, students. It's great to see you here. Often we hear from superintendents, principals, and teachers, and guys, don't take this personally, but I'd much rather hear from the students. So we appreciate you being here, your participation in this, your passion for your fellow students across the state. Sometimes events happen in life, stressful events. And one of the points you made was the issue of stigma. So many times people aren't willing to admit to somebody else, I need help. And I think it's very important that we emphasize this. And I'll share something with you I haven't shared with a lot of people. There was a period in my life when I suffered from depression. And I was on medication for a period of time. I'm not on that medication now. But it's nothing right. It's all right to ask people for help, to tell people that I need help. And that's a message that we need to share as adults. You all need to share as students. There's nothing wrong with asking for help. Another point you all made was you talked about peer-to-peer. I think that is so valuable. If you have students who have gone through this issue and they've dealt with it, to be able to talk with each other, and I would encourage, however the mechanism is, whether it's on a local school level, this needs to be set up. Whether it's a student-led initiative, just start your own group. It needs to happen. I've always believed you need to plan your work. And when we talk about mental health, when I asked about funding last time, I was told we need a plan. So I appreciate the input and the work that you've done on this. I think it's valuable as we consider planning for the 2023 session. But I do have a question. The pandemic's impacted a lot of people. and I know you all have done your survey result. I want to ask your opinion. If we can have a year or two of what I'll call a more normal school life in general, do you all believe that students will get back to more normalcy? And do you think that if you redid this survey a couple years after more normal setting, what do you think? Do you think the results would be the same, they would improve, or maybe even get worse? I'm just curious about your thoughts on that.
I could go. I think one thing that we didn't really talk about today, but we talked, I guess, hinted at it, is adverse childhood experiences, or ACEs. And so this was kind of played a big part around the recommendations. But just as, 2 years goes by, we still went through that pandemic. And I think you all know this, we know this, that it's just not going to be the same as it was before. And so even though 2 years goes by, I think that it is going to be different. Hopefully more normal, like we would like to say, but still different. And maybe for the whole student's life until they graduate high school and beyond. But with that, I think looking at how those ACEs play into it is definitely a large impact with how we can deal with the mental health and the initiatives around it.
Thank you for that answer. And we talk about events. I spent 4 days in southeastern Kentucky last week. And we've got the folks over in West Kentucky that were impacted by the tornadoes. Those students are going to have difficult times. It may be several weeks, couple months before they can even get into a school building. So we need to be supportive of them and acknowledge that those students, those teachers, those administrators are dealing with a lot right now too. Thank you, Madam Chair.
So, and I'll add a couple of points to that. I'll be quick, I promise, Representative Huff. In eastern and western Kentucky, as we've helped to recover and rebuild from natural disasters that if you saw with your own eyes, you still probably wouldn't believe. One thing that we've been consistently concerned about is the trauma that is going to follow these families. People who have lost loved ones, people who have lost a lifetime of what they've worked for. How do you even begin to take a step forward after that? And so one of the things that we have been very active about is sharing the mental health provider resources from the region with all of the superintendents and school leaders, because that's important for kids and families. So often our schools are the touch point for many of our families in the community. And so I kept thinking as I was doing that, man, it would be so much better if we had an infrastructure in place. We weren't building the plane as we were flying it, which is what it kind of felt like we were doing. And so, in times of trauma, it's needed. We need that infrastructure built and provided and normalized. And I would also say this is no new news to you all, but in Kentucky we're challenged with issues of child abuse and neglect. We're constantly in the top 5 states in the nation for those things, for children in kinship care. So many of our grandparents are raising their grandchildren. And there are lots more issues that go into it than that. But those ACEs that were mentioned earlier, I think are critically important. And while we would love to prevent all of that, and I know you all work every session to do that, this is certainly a safety net as students grow up and continue to deal with these challenges that we can provide for them.
Representative Baker.
Thank you, Madam Chair. Students, thank you so much for your work and your passion on this issue. Every student is precious, and they deserve our best. They truly do. With that being said, I have a number of concerns and questions about some of this, and I'll just leave you with one question on the information provided. But I would urge my colleagues to make sure that we do this right. Whatever we do, make sure it's right. Let's don't rush to throw something together to pass it in 2023 to say that we addressed the issue. Specifically related to some of the things that have been set forth today. But my question is on the student recommendations requiring the annual evidence-informed mental health professional and development for all school staff. I hear from teachers all the time that they want to teach. They want to teach math. They want to teach science. They want to teach reading. They're not mental health professionals. They're not equipped to address this. What would you say to a teacher who faces that additional challenge of going through this process each year and trying to now become a mental health professional as well as every other hat that they wear? Teachers are overwhelmed. Lieutenant Governor, how would you address that? What would you say to that teacher that feels that they're now having additional requirements placed upon them?
So I think it is really, I think that's a valid question. And as a teacher myself, there were days where I felt overwhelmed. And I think it was Representative Bojanowski maybe that mentioned this earlier, the importance of making sure that our professional development is valid, is updated, and is purposeful. There are so many things that are still on the books that are requirements that are adding on to the plate. And as you add on, it's really a smart thing to do to start to remove some things that are no longer necessary. I was a teacher who would have loved to only had to worry about teaching government and social studies all day. But we don't have given the way that things are now, we don't have the luxury of not teaching the whole child anymore. It truly is about teaching the whole child. This is not about teachers becoming, mental health clinicians. It's about teachers recognizing warning signs to be able to refer students to those mental health professionals. As I said before, I was a teacher for many years and never had any kind of training in how to notice those things. I had students in my classroom every day who were couch surfing, who were homeless, who were hungry, who were in foster care, who were just struggling daily. And I would give anything to go back and know the steps I should have taken to get them the help that they needed, not to be the one to provide the help to them, because I'm not capable of that. But my job as a teacher is to teach and care for the whole child.
Okay, thank you.
Representative Decker.
Thank you. Lieutenant Governor, thank you so much for your work. And students, I applaud you. You made wonderful presentations today, and you should be proud of your advocacy. I do think suicide prevention is something we should spend a lot of time on, and I think it is very important to include student voices. The one thing I'm concerned about, however, and that I'd like to hear more about, perhaps in follow-up with some of you, but I heard nothing about parental rights in all of this. So I think that one thing I worry about with our public schools is the loss of confidence that we're seeing in various areas by parents. I think from what I've seen, enrollment has gone down in some of the public schools and up in the private schools. This worries me that I haven't heard anything about parental role here. I think parents need to have a role in this type of a discussion, and it's a student initiative, I get that. But before we really pay attention to these, not pay attention, but consider seriously your recommendations, I'd like to hear from parents and what parental rights are going to be protected. Most of the children, a great majority, are minors. And I have seen and heard some disturbing things on social media about teachers saying, I will never tell a parent anything that the student says to me. So I'm just wondering, I think we have a health care crisis, a mental health crisis, but I think the way to really work on that is strengthening the family unit. And so I would like to know, and we don't have time to go into today, but will this take away from the family unit, or are there safeguards, et cetera?
So let me speak to that from a school standpoint, and then students, anyone who wants to jump in from your perspective, I think that would be very valued right now. From a school standpoint, every single school building has a site-based decision-making council where two parents of students who are currently in the school are there. Those are the places where decisions about curriculum and budget and things like that are made. So there's parent representation there. If you are on this committee and you are a parent, raise your hand. There's lots of parents involved in the policy making. Mm-hmm. Many local Board of Education members are not required to be parents, though many of them typically are. I don't know what the number of percentage is for teachers who are also parents, but I can tell you it's pretty darn high. And so there are parents from the school side of this that are involved. In terms of parents that are not affiliated with any of those leadership positions, if the students have anything they would like to add, I would welcome that.
If I could just jump in, I'm not talking about parents being involved in policy making. I'm talking about parents being involved in their own children's mental health and what they're getting at school in the way of counseling and mental health services and treatment.
Right. And so the any policy that comes out of here is coming from people who wear two hats. You're a legislator and you're a parent. Most of you are. Same with the site-based decision-making council. You're a parent, but you're also an SBDM member. None of these things are going to go through those avenues without parent input.
But I'm saying a child is going to receive this
Representative-
treatment. Child is going to receive the treatment. And the parent, what are their rights? We can talk about it.
Representative Decker,
Thank
maybe you can follow up
Yes,
later with
thank
this.
you.
Thank you so much for your presentation again and for your time and efforts on this very important matter.
Okay.
We sincerely appreciate you joining us today.
Thank you so much.
Thank you. Next we have
Answering a different question.
presentation from Jefferson County Public Schools. Dr. Marty Polio will join us today, and I appreciate him taking time from his schedule. Folks, we have 45 minutes, so I hope that we can get through this and get all of the questions that we want, but you can also follow up later with any other questions you might have at the end of this presentation. If you would, please introduce yourself for the record, and you may proceed. And again, thank you for joining us today.
Good afternoon. Marty Polio, Superintendent, Jefferson County Public Schools. Thank you for having me here today. First and foremost, I want to recognize those students as well, being superintendent. You know, that incredible for them to come and sit in front of you and present that information and the work that they've done. That's the type of work that needs to be done in school, these type of things. I know there were at least 2 JCPS students that presented to you today, but I think all of them were fantastic. And I do think it highlights a problem. I mean, if we talk about 20% of our students have mental health issues or an illness, and only 1 in 5 are being addressed, that means in JCPS alone, there are more than 15,000 students who are experiencing some kind of mental health illness that is not being addressed. And so I think that just signifies the importance of this. But thank you for having me here today. I'm excited to be here to talk about JCPS and some of the work that we're doing, some of the deep work we've done over the past couple of years and continue to do through the pandemic. Looking forward to your questions. And so I do want to say that I never thought I would be in this seat sitting in front of you. I really didn't. I was a teacher and a principal, loved being a principal, was a principal for 10 years. Somehow I ended up here. I blame 3 people in this room for that. First of all, Representative Miller. In 2003, I interviewed for an AP job at PRP. You did not hire me. So I look back and think maybe if you had, I wouldn't be here right now. Dr. Burks in the back tapped me on the shoulder, as many of us as leaderships have done, and said, you should do that. You could be a principal. And that kind of set me on this path. And obviously Representative Wilner, who hired me as superintendent, interim superintendent, and then permanent superintendent in 2018. So I blame them for this. It's a tough job. It really is. I don't know if there's been a tougher time to be an educator. That's well documented. I know at your last meeting you heard a lot about that, but I can't say enough about how difficult it is right now. And that includes any type of classified or support position, teacher, administrator, principal, and superintendent. It's a major challenge, and it's been a tough time to be a leader. I know you all probably recognize that as well. It's been a tough time to be a leader for many of you, and it's not easy. And unfortunately, that's translating into a lack of superintendent candidates all around the nation as well, which is a concern with the other vacancies that we have all across and the shortages that we have all across the United States in education. I'm proud to be sitting in front of you. I wouldn't do this difficult job if I didn't care so much about Jefferson County Public Schools. I am now in my 26th year in JCPS. So I have spent at least half of my life being a part of JCPS. My parents were teachers, either in JCPS or the old Louisville public school system. I'm also a JCPS father. And so it's all very important to me, and it's very personal to me. And I can't imagine doing this job if it were not being in such a difficult role, if it was not personal, where you wanted it to be better. You wanted to improve. And that's what I focused on over the past few years. So I'm going to walk you through a few things here about JCPS and really talk about our improvement process, because we've done a lot of things to improve JCPS. We've got a lot of work to do as well ahead of us, and I want to highlight those things for you. So JCPS at a glance right now, we have about 96,500 students in JCPS. We are about 1 out of every 7 public school students in the state of Kentucky are from JCPS. About 68, almost 6,900 teachers, 165 schools. You see the meals we serve. That, especially during the pandemic, was a huge resource for the community. About 80% of the kids in Jefferson County attend JCPS, and you can see we have 139 languages spoken by students and families throughout our community. And so that complexity provides some challenges, but also provides for great diverse school populations that we love in JCPS. I'm not going to read all of this to you, but this is the demographics of JCPS in 2021 compared to the Commonwealth of Kentucky all across the state. I think you can see this. I do want to highlight a few challenges as a result of this data. First and foremost, I want to do free and reduced price lunch. So it is looking like this year we will eclipse 70% of our student population being free or reduced lunch. So, you're talking 68,000 of our students that is the measure that we qualify in education for that mark of poverty. And I want to say this, I became a principal in 2007 at Jeffersontown High School. At that time, 55% of the students in JCPS were considered free and reduced lunch. So in 15 years, we have grown free and reduced population by 15% in Jefferson County. That's nearly 15,000 more students are living in poverty in Jefferson County than they were just 15 years ago. And I think that is a significant concern that we all have to say is a problem. I will talk to you about outcomes. We've got to improve our outcomes in JCPS, especially our achievement gap. But we all know, as many of you are educators right here, one of the number one correlations with achievement is poverty. And so, that is a major concern. We also have over 6,000 homeless students in Jefferson County Public Schools. Also, our English language learners, you can see, is about 13% of JCPS are English language learners, which is a dramatic increase from about 10 or 12 years ago. Once again, I say that. We celebrate our diversity. If you ever want to come to an incredible school, come to the ESL Newcomer Academy. It is a fantastic school for students who have just come to the United States. Just recently, I celebrated with them their 15th anniversary of the ESL Newcomer Academy. And saw a young man who had come to us from Cuba 5 months ago singing opera in Italian in front of the entire student body. And it was an incredible experience. But it also provides challenges as well, as we know many of them come to us as non-English speakers, and that's a challenge for us as well. So those are some of the things I want to just highlight as challenges as we move forward that we have to face. And so I'd like to tell you a little bit of a story. I told you there are benefits from being a superintendent who was in the district for 20 years before becoming the superintendent. I was a basketball coach, a teacher, athletic director, assistant principal, and superintendent. So I've run the gamut of different responsibilities throughout the district, including 4 different high schools. All of them were high poverty high schools, but did all of those positions. The benefit from coming within the district is you already know the challenges. Coming to a district with 165 schools from outside is very challenging. It takes a long time to learn the challenges, the benefits, the complexities of a large district. On the other side of it, though, is being within the district and having all those relationships can be both positive and a challenge at times. But I stepped into the position knowing very well some of the challenges that we face. And once I got my feet on the ground in 2019, we dug deep and said, what is our current state and what changes need to be made in JCPS by 2025 in order to accomplish the outcomes that we want? Specifically, higher proficiency of our students, dramatic increases in proficiency, reading and math, having our kids having the life skills that they need to be successful. We call that our backpack of success skills. Reducing or even eliminating the achievement gap that has been existent in our community and most communities around the state and nation for many, many years. But if we're going to do that, we've got to change the way we do things in JCPS significantly. And I had at that time felt like things hadn't changed significantly across the district in every single school. And really more about the foundation of JCPS. So programs had come and gone, people had come and gone, but the challenges remained the same and the foundation had not changed. So let me point out to you some of those challenges that we've looked at here in JCPS. As we implemented this and began to tackle these issues, COVID hit. But we have continued to fight and move forward even during the pandemic. First and foremost, I've talked about it a lot, our inequitable student assignment plan. Our student assignment plan had been the same until we just passed a new student assignment plan on June 1st, 22. It had been the same for nearly 40 years. And so we had to say, yes, diversity is important to us and critically important to us. But who has the onus and responsibility of diversity in Jefferson County? That was our black students primarily from West Louisville. About 95% of the students that were bussed out of their community in West Louisville were black students who were going outside to achieve diversity in suburban area schools. So, for example, if I was a principal at J-Town High School, if I lived across the street from J-Town High School at 9601 6 Mile Lane, old 6 Mile Lane, I could walk across the street and enroll my student in J-Town High School with proof of residence. If I lived at 41st and Market right across from the Academy at Shawnee, I could not do that. I would have to send my student to Pleasure Ridge Park High School, approximately 10 to 15 miles away. And so I find that to be incredibly inequitable. I find it to negatively impact student belonging. It has negatively impacted student attendance. Quite candidly, we have a student attendance crisis in our community and most large urban cities across America that has to be corrected. This is one piece of it. It's not the only piece. Also, with our magnet schools, ensuring that our magnet schools reflect the diversity in our district was something that we had to change. This had not changed for 40 years. We have now passed the new student assignment plan that will go into effect in less than 12 months. We're planning on the implementation of it. As a result of students not having the opportunity to go close to home, what we've had are no schools, middle or high, built in West Louisville since 1952. That was prior to Muhammad Ali walking in the front door of the school at Central High School. And so now we have challenges in front of us of implementing this plan. We are giving every student in Jefferson County has the opportunity to go to a school close to their home, elementary, middle, and high school. They also have an opportunity to go away if that's what the parent chooses for specific programs. We also have reduced our feeder patterns so that now we only have 18 feeder patterns between middle and high school, whereas right now we have about 94. So we have kids who are forced right now to go to, I've said this often, to Camerer Middle School in far East Louisville, and then their assigned high school is Valley High School in Valley Station in far South Louisville. And so that is not what's best for the student. We have changed that. I'm proud of that. I can't wait for the implementation. I talked about improving student outcomes. I'm not going to step away from that. We have to do that. COVID has had a large impact. I am proud of some of the progress we continue to make. I think you will see when our report cards come out, school report cards and district report cards, we have the highest graduation rate, the class of 2022, of any JCPS graduating class in history since we started the 4-year graduation cohort. We have the highest amount of post-secondary readiness that we've had since that indicator was started. That comes from the academies of Louisville that we have worked on that I think is one of the top in the nation. I've talked a lot about our aging facilities. We have never taken the second nickel tax in Jefferson County. We had never taken that. And I know increasing tax rates is very controversial, but our infrastructure was at a and it is at a critical state right now. We have built 4 schools in JCPS since the turn of the century. Fayette County Public Schools has built 12. They are 2.5 times smaller than JCPS. We have over 30 schools that are past the end of life. The last high school that was built in Jefferson County was in 1968, Ballard High School, 1968. So we're talking 53, 54 years old now. I think Fayette County alone has opened several high schools, just opened one, I believe, recently to start the school year. And so that comes, I believe Fayette has done 2 nickel taxes since that happened. So we went into COVID, and I'll admit it was controversial and it was tough, but I had to look myself in the mirror and say what's best for the kids of JCPS and the kids of our community is to have high quality facilities. Because I do believe this, when you have what the facility is, that is symbolic to the child of how much the community cares about them. When I took over in JCPS in 2017, we had a high school in West Louisville, Shawnee High School, that had a condemned 3rd floor, and it had been condemned for 35 years. When I taught there, I asked, what's on the 3rd floor? He said, nothing, it's been condemned. That has been fixed, and we are now building 4 new schools. We opened one on the first day of school. We'll open another in about 2 weeks. We have 2 more being built. We expect to build 8 to 10 in the next decade. So very proud of that facility work. Very outdated technology with a huge technology digital divide that we think we've really worked on over COVID. That's really helped our ESSER funds. And definitely inadequate investment in workforce development. We really have to make sure that we focus on building teachers, building principals, making sure that we attack this shortage, because there is no doubt that this shortage is not going to go anywhere in the near future, and we are going to have to be very assertive about it. So as I said, and I won't, some of the future state goals that we've had, improve the student assignment plan. I'm very proud of that. Resource our high poverty schools. I do believe this. Students who have the least amount of resources in their home need to have the most amount of resources in their schools. That needs to happen. We had not done that in Jefferson County in a significant way. We are now doing that as a result, where our schools of high poverty have more support, more financial support than they've ever had before. Our teachers will be paid more to be in high poverty challenging schools, as well as our principals and other administrators the same way. I told you about our facilities and our investment in our facilities and what we're doing with that. Technology upgrades, we are at 1-to-1 right now. We are one of the few districts in America that we hand students a Chromebook. Internet is built into the Chromebook, so the child can take that anywhere with them and access the internet at school, at home, on the bus, wherever that might be. And then workforce development, really investing in us building our own. So we have a teacher residency program where we are certifying teachers. We are training principals. We have to do that. We can't just depend on post-secondary institutions. We partner with them, but we just can't depend on that happening. And so this has been huge work. I also want to say this. I think it's important to note. We have you may have heard of this, and they may have sat in front of you, but we have a partnership with Evolve 502, a collaboration in Jefferson County. I don't know, there's not many cities, there's a few, but there's not many cities around this nation where every single child in a JCPS high school right now is guaranteed any eligible student is guaranteed tuition-free payment to go to JCTC or Simmons College of Kentucky, and qualifying students also can have a 2+2 at the University of Louisville, and opportunity grants for eligible students to pay for things at college that they need. So post-secondary, that financial need, every student has the opportunity to do that in JCPS. And so and I did want to say Marlon Cole and the Evolve 502 team is here, so thank you for joining us today. I did want to recognize them because they've done incredible work to help us out. Ongoing challenges that I just want to highlight. I told you about increased poverty. You know, through my time, kids haven't changed a lot. I think cell phones have changed the name of the game a lot of bit. But poverty has grown dramatically. Mental health needs of kids has grown dramatically in the time that I've been in JCPS. And so this is something that we continue to wrestle with on a regular basis. There is no doubt well documented our teacher and workforce shortage. You know, I will say this, we are operating right now on about 200 less bus drivers and nearly 300 less teachers than we were a decade ago, classroom teachers. And that is a major challenge. Last year, we went into the year thinking it was still, you know, normal. Let's get everybody, teachers in a classroom, and let's hope we get new candidates coming into our classrooms. And that just didn't happen. And yes, we had more resignations, like many industries have had, and we have vacancies now. But what we did say is, all right, we're going to have to do things differently than we've ever done, and really change the paradigm of how we do school to meet the needs of our students and make sure a certified teacher is in front of them. However, I will say this, we get a lot of focus on JCPS. I will say this, in most of your districts, the same vacancies occur at the same rate as in Jefferson County. So if a neighboring district of ours has 50 vacancies and we are 7 to 8 times larger than they are, that's equivalent to us of 350 to 400 vacancies. So the challenge is great when it comes to shortages of workforce all across the Commonwealth and the nation. I know you all talked about it at your last meeting, but I can't say enough. With the drop in enrollment and post-secondary certifications, the amount of teachers who are eligible for retirement, I have real concerns about the looming crisis over the next 10 years that I think has to be taken seriously. And then rebounding from the pandemic, my daughter's a senior in high school. She's had every year of high school impacted in one way or another by the pandemic. But we know that students from poverty, students of color, have been impacted in a way, especially around achievement, that we have to focus on how we recover from that and come back. And I'll say, I am proud. 4 years ago, we had no students, or a very small number, in any summer learning. This year, we had 10,000 students in summer learning, 10,000 students for a 4-week program in summer learning. That is as much as almost any other city in the United States. Because I think right now, I told you about the attendance issue. We have about a third of our students right now who are chronically absent. Chronically absent means 18 and a half school days a year. That's an enormous challenge when it comes to ensuring that we get kids to proficiency. If they're not in school, it's going to be difficult to get them to where they need to be. I think we would all agree on that. So getting them in school, tackling those issues is huge, and then making up those minutes, that seat time in front of a certified teacher that they may not, in order to recover that learning loss. That comes from summer learning. That comes from us opening an Elevate Center in West Louisville, which has certified teachers for the students from 3 in the afternoon until 7:30 at night. And so right now in JCPS in West Louisville, we can have them in front of a certified teacher from 7:30 a.m. to 7:30 p.m. We will continue to do that and grow that throughout Jefferson County. But that is the very intentional work that has to be done in order to recover from the pandemic. And I will finish with this, one of my favorite quotes. I heard it from one of my favorite speakers about 2 weeks ago, Steve Pemberton, who spoke to our administrators. Society grows great when old men plant trees whose shade they know they shall never sit in. So a lot of this work we are doing right now in JCPS, we may not see the fruits from that work or the shade from that tree until after I'm gone. But I do believe it's the work that has to happen to change JCPS and will change JCPS for decades to come. Our facility work, our student assignment work, that may be 10 years down the road before we really see those outcomes. But it has to be done now in order to get there. Thank you for your time, and I'm happy to take any questions you have.
Thank you very much. We do have several questions. I want to caution the members that we will get to as many as possible, but we will be adjourning at 1. So with that being said, Senator Meredith.
Thank you, Madam Chair, and thank you, Dr. Polio, for being here this morning and for your testimony. And also appreciate you identifying the problems that Jefferson County school system is facing, and that as you went through your presentation, I'm thinking, these are the same things that we face in all of our school districts, and of course, yours is quite unique because of size. But I've got one question for you. But let me preface it by saying that I have nothing but respect and admiration for the job you've done since you were named Jefferson County
Thank you, sir.
Superintendent. I think for the most part that your work has been quite admirable. I like the plans you have today.
Thank you.
But I'm going to admit that I was disappointed, distressed, and disturbed when I read in the Courier Journal on April 13th of this year that you made the following quote: "If you really want to improve outcomes for students, the senator from Litchfield," being me, the senator from Greensburg, being Senator Gibbons, the senator from Manchester, being President Stivers, will allow us to keep our SEEK dollars here in Jefferson County, and we'll stop funding their schools. Not sure why the three of us were singled out, other than we have been united in our criticism that the children in the West End of Louisville have been denied a quality education for too long. But I have two questions for you. First, is this your position, still your position? And if it is, do you really think it's the best interest of your school district to throw down such a politically charged gauntlet, especially by your own admission that you had almost no conversation with our legislature during the 2022 session? That was also in this article. And you're certainly aware of the urban-rural divide which exists within our chamber. So are we building bridges? Are we burning bridges? So is this your position?
Well, I'll say this, Senator Meredith. I watched along all session, just like most of our constituents did in Jefferson County, just like most of our teachers and many of our parents. There was a lot of discussion about JCPS in a negative way. I'll say this, I take it personally. It is personal for me, this job that I do. I've been in it now for 26 years. I've dedicated my life to it. My daughter's in the school district. I take a lot of pride in JCPS. I think a lot of people think JCPS as this large building somewhere. Essentially what JCPS are the people that are in it. And I take a lot of pride in that. So, yeah, I took it personally. I mean, the dialogue that I heard in this room, I took that personally. So I was upset about a lot of the conversation about West Louisville. I was upset about a lot of the direct pointing fingers at outcomes of JCPS, when if we really dig into everyone's data, yes, most districts don't have the black students that we have, and it's hard to compare. But if we compare free and reduced lunch to non-free and reduced lunch students all across this Commonwealth, we see the same gap. So, no, I believe in the SEEK Fund, sir. I believe that that's the right way to do things, to make sure that every student in this Commonwealth gets what they need to be successful. But, you know, I can say I was upset with the dialogue that occurred here during that time, and probably spoke up that night as a result.
Well, I think I can make a commitment on behalf of all of our legislators, all 138, that anytime you have an issue, we're available to you. Phone call, visit, text, whatever. And I believe we're truly committed, even though most of us are rural in nature, to making Jefferson County school system succeed. I think the action we took back in 2019 to give you additional authority and power within your school district is evidence of that. So we're here to support you. But I would hope you'd recognize that we do face these same problems in our rural areas, and most of the problems is because of lack of funding as well. And we hear a lot of times that Jefferson County doesn't get its fair share of tax dollars. I'll take issue with that, because you get our retail dollars, you get our healthcare dollars, you get our recreation dollars, and you get a good chunk of our workforce. We would trade that on any given day with you.
And I'm happy to sit here at this table anytime during the session where you have questions for me. I'd be happy to come and answer those questions as well.
Well, thank you, and I wish you the best going forward.
Thank you, sir.
You'll have my support. Thank you.
Representative Bojanowski.
Yes, thank you. I'll be very brief. I think out of the three areas, and this kind of transcends all of them, I believe, what I'm seeing in the classroom this year, at the beginning of the year, as well as the beginning of last year, is the number of incoming students to kindergarten who have never been to school before, they've not been in preschool, who have severe disabilities, nonverbal children with strong characteristics of autism. I just want to bring that to the forefront and share with my colleagues that that's a major concern. I know that per special education law, there are 60 calendar school days before they have to go between, signing for consent for an evaluation. But what I found last year is that's then months that a child is not getting the supports that they need. And as a parent of a child with autism, I know that intervention should be early and it should be intense. And so I just wanted to bring that concern to the committee. Thank you.
Thank you. And I would say this, that along with that concern is not only the shortage of special education teachers, but also the shortage of special education support staff that do the work, like identify those needs for students, do the testing that is necessary to make sure that students are identified as special ed and get the services that they need. Right now, what we are doing is putting those folks into classrooms right now. And so I want to thank our resource teachers, those that are supposed to be doing that work. We're putting them in classrooms right now so that students have a certified teacher in front of them. But there is no doubt that, and I think any educator would tell you, that the needs of students coming in the classrooms today is greatly increased from what it's been in the past.
Senator Thomas.
Thank you, Madam Chair. And Dr. Polio, I'm glad to see you because I have to admit that what you say is personal to me as well. There's no secret I represent Fayette County. But I only have 3 grandchildren, and all of whom go to Jefferson County Public Schools. I've got a 7th grade granddaughter there, a 3rd grade granddaughter there, and a 1st grade grandson there. So what you do in terms of educating them is very personal to me and my family. So I'm appreciative to hearing from you today. And I am so glad to hear that you have a facilities plan that's moving forward. Because you mentioned 1968 as the last time you built a high school. And I remember you said that back in 2019 when we were in Louisville. And since that time, 5 of the 6 high schools in Fayette County have been built since 1968. And we just put $84 million into the high school that in whose shade my house is in, Tates Creek. My house is shaded by Tates Creek High School. So anything that you can do to advance your facilities and build new high schools and build new schools, you will always have my support because obviously it's good for the children of Kentucky to do that, but it's also good for my grandchildren.
Thank you, sir. And I'll say the challenge we face right now, districts build schools from bonding capacity, which is essentially, 20-year loans, just like you would on a house. Our challenge is the hole that we are in right now because nothing's been done for the better part of 20 years in any significant way with facilities, that we are in a hole right now of getting out of it and really tackling which projects are first. But the only way to do that is to start taking that step and begin rebuilding many of these schools, which we're going to do. Thank you.
Representative Miller.
Thank you. Marty, you've always been successful as a teacher, as a coach. Your 4 high schools were all good.
I don't know about coach, sir. I was shaky as a coach.
So, and you're doing a wonderful job now. So I want to compliment you on the work that you're doing now. I think you're trying to do what you think is right for the students and for all parts of Jefferson County. I do appreciate the new school that you've put out in southwest Jefferson County. It's a couple of weeks before it'll open, but it's a beautiful school. But I was thinking about our enrollment hasn't gone down really that much in the last couple of years, I don't think. But I know teachers' numbers, and you're doing a great job in preparing a lot of the people we have a lot of people that are aged now that only like about a year being certified. So I know we got a lot that I know that are getting certified. But I just wanted to say that and maybe ask you about the enrollment. How is it compared to 2 years ago or whatever?
Sure. So our enrollment right now is about the same as it was 2 years ago. We've been between 95 and 100,000 students for the better part of 10 to 12 years. And so what we are anticipating right now, we still have one of the challenges in an urban district is between the first day and the 10th day of school, we enroll about 6,000 students who did not come on the first day. So we're continuing to enroll all the way through the 10th day of school. Then we begin early childhood as well, which is about 2,500 students. So right now we project to be about 99% of our projected enrollment, 99.5%, and right at about 96,000 again. The numbers, the data that we're looking at long term say that we will probably go up above or close to 100,000 or above in the next decade. So I think we have seen our enrollment be very steady over the past few years.
Senator Southworth.
Thank you. I might be the newest Jefferson County legislator here.
I think so.
I am looking forward to getting to know more of the people there because I know when I worked for Lieutenant Governor, she spoke very highly of you. I don't think we've actually had an in-person sit down together. But I'm getting to know, obviously, some of my new constituents, and my emails are loading up after the recent thing about these masks. And I think it's district-wide. My understanding is that it's district-wide. And I really love what I heard about Western areas getting schools. I'm hoping that's as good as it sounds because it's something I've been talking about for several years. But I wanted to know about the mask situation. Mm-hmm. Were there community surveys? Was it looked at school by school? What is the reasoning? Because you're talking about trying to come out of the pandemic, and yet, I'm glad that you're setting an example because we've not seen that all the time with leadership, but the rest of the room doesn't look like JCPS. Mm-hmm. And so it's not coming out of the pandemic. Yep. And I just want to know, when can we expect JCPS to come out of the pandemic? And can there be a more nuanced approach? Like when somebody is sick, they stay home rather than all 100,000 kids will wear a mask.
So great question, Senator Southworth. And we have a board meeting tonight. There's nothing like testifying in front of you all and then going to a board meeting this evening where it may be discussed among our board members. I mean, first of all and foremost, I want to say it's a local decision in every community in the Commonwealth of Kentucky. Whether it's an independent school district or a county school district, it is that school board that decides that. And I know we've talked about local control a lot. From the very beginning of this, and I'm going to say this has been one of the most frustrating, difficult, taxing decisions on superintendents across America. And we are a very divided community on this issue. And many times it's divided based on race. I mean, that is a fact that we have to know around mitigation of COVID. And so I've struggled with it. It has not been easy. It has been, for the past 3 years, since 3.5 years, since October, or 2.5 years, since March of 2020. Every decision has been excruciating on recommendations that I send to the board. Early on in this, I said I would follow CDC guidelines. In March, our Board of Education gave me the authority to come out of masking based upon the CDC guidelines. I was on a conference call yesterday with the White House and the CDC. It is clear what their guidance is. I mean, it is clear what the CDC says should happen when you're in red. They say clearly, we recommend universal masking when a community is in red. The Kentucky Department of Public Health says consider universal masking when in the red. So we can disagree with that. I would appreciate it if everyone would take their frustrations out on CDC and KDPH as well, if that is the scenario. But we could come out of it as soon as Friday morning. Numbers are going down. My authorization by the Board of Education right now is when we go into yellow, I have the authorization to make masks optional. When we are in green or yellow, it can be optional. That was passed again in mid-July. Just so happened that 2 days later, we went into the red. That's my responsibility to follow board decision and board policy, which is what I did. So hopefully we will be in the yellow. We're seeing declining numbers. It's just a matter of how much declining. My anticipation will be in the next 2 weeks, we will see a community that's in the yellow. I can't promise that, but as soon as that happens, masks will be optional.
Thank you.
Representative Donahue.
Thank you, Madam Chair. Good to see you, Marty.
You too,
I
sir.
just want to make a comment here. I want to thank Representative Miller and Representative Wilner and Joe Burke for their past decisions, because they were good
I'm not
decisions.
so thankful.
I am thankful. But I want to say this, I'm thankful to you, and I'm thankful for your team, for your passion, for your dedication, your leadership, and I was going to leave it at that, but I got to respond to the comment about the schools as a legislator. We raise our hands for these jobs. And in Frankfurt, the easy target's been Jefferson County Schools, fire a bullet across the bow, and it's happened for years. We raise our hand for these jobs. That stuff should just go right by us. We are here to make sure we advance all students and everybody in every part of the state of Kentucky. So I believe that statement came out of your dedication, your passion, and your leadership for those schools. And I agree with my fellow legislator up there. We're here to do anything we can to help you move forward. Thank you, Madam Chair.
Thank you, sir.
It is now 12:57. Senator Wise will have our last question.
Thank you, Madam Chair. Dr. Polo, good to see you this morning. Thanks
too, sir.
for being here. I know getting in front of a committee like this in your position is tough. My question being, the performance, I think a lot of times of superintendents is based a lot on the relationship they have with their school boards.
Mhm.
And looking at that, recently I was interviewed by the media, and I think also JCPS about their school resource officers or SSOs. A comment, it seems to be that the Jefferson County School Board has skirted around legislation we have passed about SROs within the school walls of Jefferson County, putting them in parking lots, maybe a neighboring type of authority that they have. Where are we currently with your SSOs and with your school boards? Do you see some implementation of some things that are going to be taking place to be compliant with the laws that we have passed out of Frankfurt?
Yeah, first and foremost, Senator, thank you for the question. I want to say this. I've spoken often with the state security marshal. We've had conferences to talk about making sure we are in compliance, and we want to be in compliance with the law. There is no doubt about that. At this time right now, hiring police officers is a challenge as well. So I will say this, the funding for SSOs, SROs is fantastic if we can get that. That's not the biggest challenge facing us. The biggest challenge facing us is personnel. I believe LMPD is down 250 positions vacant right now as well. So we have been actively hiring. Last year, we only had 10 security monitors in JCPS that were district-wide that would respond to a school. Right now, currently, we have 11 SSOs that are armed officers. We have 4 in training this week that have had previous police training, law enforcement, so they can jump on. So in the next couple weeks, we'll be up to 15. And then we have about 17 more that still need training or the police academy in order to be on. So all in all, we'll have close to 35 police officers, SSOs, by the time that we get everyone trained. A challenge for us is how often those classes are offered and how long it takes to get them certified as police officers, rightfully so. So, I don't know, Senator Wise, if there is a future where we will ever see 165 police officers in Jefferson County. I just don't know, and all across this state. I do think we can continue to build, and I've told the state security marshal that is my interest to make sure that we build that. and that we are there to support schools. So they have to be assigned to one school. They can serve other schools, but they have to be assigned to one school. So I only have interest in making sure we follow the law, as you all have spelled it out for us in conjunction with the state security marshal.
Thank you.
Thank you, Dr. Polio, for joining us today and for your dedication to the education of JCPS.
Thank you.
Members, our next meeting will be September 20th. Do I have a motion to adjourn? Second. We are adjourned.